Good evening, dear viewers, and welcome to a new edition of the Daily Debate. Egypt's health sector has undergone significant advancements. It's really a journey of transformation, a transformative journey in the past years to improve medical infrastructure and increase the availability of healthcare facilities, among other axes. The health sector in Egypt has seen remarkable progress marked by improvements in the medical infrastructure, an increase of the number of hospitals and health centers, and this is part of the broader effort of course, by the government to enhance the quality of healthcare services provided to citizens and to ensure comprehensive health coverage for all. Efforts have not only advanced the quality of medical services, but have also expanded universal health coverage, ensuring that more Egyptian citizens have access to essential and quality-like healthcare services. We'll be talking about the progress that has been witnessed in Egypt's health sector in the recent years here tonight in the Daily Debate. And we have the privilege to have with us here in the studio Dr. Abdel Hady, Dr. Abdel Hady, the former Dean of the Faculty of Medicine at Al-Mansoura University. He's also the president of a private university here in Egypt. A very good evening to you, Dr. Abdel Hady, and thank you for coming here to Nile TV.
Thank you for having me.
Thank you. Allow us, Dr. Abdel Hady, please, and allow us, dear viewers, to first watch a report on our main topic for tonight and then come back and start our discussion. Please stay with us.
Pleasure. Yeah.
The government has prioritized the construction and renovation of hospitals and health centers across the country, ensuring that both urban and rural areas benefit from enhanced medical services. This strategic focus has led to a substantial increase in the number of health institutions, thereby improving access to medical care for millions of Egyptians. One of the most notable initiatives is the National Project for the Development of Egyptian Rural Villages, which aims to modernize healthcare facilities in rural regions. This project includes the construction of new hospitals, the renovation of existing ones, and the establishment of specialized health centers. As a result, rural communities now have better access to quality healthcare services. Additionally, the introduction of advanced medical technologies and equipment has significantly improved the quality of medical services provided. Hospitals are now equipped with modern, up-to-date diagnostic and treatment tools, enabling healthcare professionals to offer more accurate diagnosis and effective treatments. This technological upgrade is complemented by extensive training programs for medical staff, ensuring that they are proficient in the latest medical practices and technologies. The expansion of universal health coverage has been another cornerstone of Egypt's healthcare reform. The Universal Health Insurance Law, enacted in 2018, aims to provide comprehensive health coverage for citizens by 2032. The gradual rollout of this program has already started in several governorates, providing millions of Egyptians with access to essential health services. This initiative not only improves health outcomes, but also reduces the financial burden on families, making healthcare more affordable and accessible as well. Overall, the concerted efforts to enhance the medical infrastructure, increase the number of healthcare facilities, and expand universal health coverage have significantly improved the quality of medical services in Egypt. These developments have raised the standard of healthcare provided to citizens, contributing to better health outcomes and a higher quality of life.
Welcome back. Thank you, Abir Hussein, for this report. And back here in the studio with Dr. Abdel Hady, the former Dean of the Faculty of Medicine, Al-Mansoura University. Dr. Abdel Hady, first of all, how do you see the substantial investments from the part of the Egyptian government in building and upgrading health facilities?
That's a very good question indeed. Actually, the vision to health has expanded. At first we said health is a complete physical, mental and social well-being, but now has expanded the spectrum from just health into being pivotal in quality of life, as you said. So now health with education and the quality of life, or the income that every person achieves per capita, has made what we call the development and human. And consequently, the change that happened in the cabinet, there is a vice prime minister for human development. He himself is the minister of health. But added to that, education, social solidarity, and also the better quality of life, including the youth, the education. So the spectrum of health has changed.
The concept itself.
The concept itself, and Egypt has followed the concept. So the choice of the minister was very, very well done, because it fits into the broad spectrum of health. That's the human capital or human development, rather than a health. Even health itself has expanded to different initiatives. So investing in health is evidenced by many indices, as we used to say. Taking into the financial aid, this year is a 25% increase on the expenditure on health. It has increased from nearly 400 million to nearly 500 million, so exactly 25%. And also education has increased from around 600 million to 850, so it's around 45%. So both are going hand in hand, health and education, and this consequently reflects on the quality of life. So back to your question, the government is investing in the human capital, is investing in health, because health is a drive for, you won't be a successful career person, you won't be a productive without good health. So this is the vision for health that is placed in its position as a drive for better quality of life for the whole community.
Right, so it's not just the health facilities or the health services, but you're telling us that also there is investment in the doctors themselves, the physicians, the nurses, the cadre.
Yeah, that's coming to the health component. So at the end of the day, if a person is ill, he's going to hospital. So we need the hospitals, our health care facilities. There should be physicians working there, so there will be physicians and healthcare team, including the nurses and the administrators. Physicians and hospitals need equipment, so you will need health equipment, diagnostic tools, and drugs, and all these facilities. There should be a governance of all these institutions, so we have now an institution or authority for financing, what's called the health insurance, another facility for providing health care, it's called the health care providing, and a third one for the quality. They are different, separate. And above this all, there is fund coming either from the government or from the people themselves. So there is the private sector and the public sector. So the whole organization forms the health.
Right. Yeah. And I guess under the same umbrella would come the pharmaceutical industry. So
Definitely.
What can you tell us about efforts in developing that industry, which has good hands in Africa, for instance, and other parts of the world?
Very good. Indeed, there has been significant improvement and innovations in this field in Egypt. We had the drug authority, Egyptian drug authority, which governs that one, but also we have a medicinal village, our whole city built for this purpose. The productivity of medications or medicines in Egypt has increased by 85%. We now export for nearly 85 countries. Although nowadays there is shortage of some medication, but I am pretty sure that is a very short period that will improve, because we don't we are short only of the dollar, the fund that the companies are pressing to increase the price of the drug, but the pharmaceutical companies within Egypt, either the national or the international one, are quite equipped with all the facilities to manufacture nearly 95% of medication needs for the Egyptian population.
Right. Dr. Abdel Hady, before we proceed further, earlier today the Prime Minister was conducting a tour in the new Al Alamein city, and he declared the launch of the 100-day health initiative.
Yeah, true.
Tell us about that
Excellent.
initiative.
That's a continuation of the 100 million health. That was a very successful initiative. It was called the Presidential Initiative. That's renounced now all over the world as one of the most successful public health policies in the world. It has eliminated or nearly to eliminate virus C altogether, in addition to non-communicable diseases like diabetes and hypertension and this kind. So there are continuations based on that 100 million. It's called 100-day health. It is exactly a continuation of that initiative, because every now and then you will need to recap or to revisit what you have done. So to avoid new coming of diseases and to build on what you sustain or call sustainability, you will have to repeat that initiative every now and then. That's a very good initiative.
Indeed, and we all know, of course, how Egypt succeeded in eradicating virus C. And before that, these efforts in the past few years, Egypt, was really suffering from that virus.
It was a stigma.
It's a great success story.
Yeah, that's a story to tell.
That was praised by the WHO.
Absolutely, yeah. There is a certificate coming from the director of the WHO to the Egyptian government, and that's in the public health is now a story to tell. What's called is published in the Lancet, published in the New England Journal of Medicine, that Egypt has made remarkable progress in a public health problem. That's virus C. That's absolutely correct.
Dr. Abdel Hady, speaking of the initiatives, could you tell us about more initiatives that have been successful in the previous period that aimed at, again, improving the health services provided to citizens across the country?
And these the presidential initiatives were very successful, starting with 100 Health, but there's another very good initiative. I can feel it as a physician practicing and as a previous dean of medical school. The cutting short the waiting list. We have patients
for operations, surgeries.
Absolutely, for the very expensive operation of patients out of jobs for years, lying in beds because they need valve replacement in the heart or joint replacement or organ transplant. I can feel this. And the initiative was very successful in that domain. Till now, what's called the state-funded cost for major surgeries is still running in the Ministry of Health, and that adds a very valuable addition. But there has been very successful presidential initiatives for example, early detection of cancer. It's running. It expands for women's breast cancer and cervical cancer, for men the lung, the liver, and the prostate. That's another very successful initiative. Initiatives for children and neonates and the school nutrition and prevention of dwarfism and autism. So there have been very successful initiatives, but the two major ones from my point of view were the 100 million, because it includes virus C, diabetes, hypertension, and the cutting short the waiting list, and most recently the cancer prevention initiative.
Right. Dr. Abdel Hady, how do you view the role of the public-private partnership in the health sector?
Absolutely. That's another very important domain. Everywhere in the world there is a public-private partnership, and we should accept that one.
Right.
First of all, the government, any government in the world would not be able to finance the bill of health unless it allocates 25 to 30% of its income for health only, because every day the cost of medication and surgical intervention is getting up and up. So the only way is either to raise the taxation on people, there's tax to finance that one, like in the United Kingdom, for example, or to allow people to share in their cost. We have public sector which overwhelmed by millions of patients every day, and we have private sector also which provides a good quality service. But without public-private partnership in education and in health, that changes that you want to do in 10 years is going to take 15 years or 20 years. So we need the public sector to chair the private sector. We need the private sector to come forward and prove that they are willing to work in the private sector for the benefit of the whole community. And I just would say there have been hospitals out of work from the era of Salam. Minister Salam was a very successful minister who built what's called compounds of health or integrated health facilities. Most of these were out of duty. Now we are in a trial to bring it back to life. Definitely the public sector, the private sector should come. Everywhere there should be partnership, there should be donations. Yeah, I used to practice in the UK, and I would say the donations for the health in the United Kingdom comes to 20 or over of the whole fund that's allocated.
20%.
20% or more for the whole fund. So people should be aware, and there should be propaganda or some form of mass media telling people that the initiative for health insurance is you pay a lot, a piece of money, or what's called pay a pence today to save pounds tomorrow, or pay pound today to save hundreds or thousands of pounds tomorrow. So that is the idea of the whole thing. But there should be collaboration between the public and the private sector. Yeah.
I'm wondering because Dr. Abdel Hady, I understand that artificial intelligence has become an integral component of the health sector nowadays. I'm wondering, how are we doing here in Egypt when it comes to AI and the health sector?
Yeah, that would need another episode, but to cut short, Dr. Ayman al-Baz, he's an Egyptian from Mansoura, is working in Louisville in the United States. He's leading the world in the field of artificial intelligence and its application in medicine. Just to let you know,
Kentucky.
Kentucky, yes. Just to let you know, now we can identify diseases 2 years before it happened.
2 years?
Yeah, using artificial intelligence. Because there is subtle or very minimal changes that occur in the configuration of the cell, just on the cell level or the very primitive unit in the body. And this, if left untreated for many years, it is coming as a cancer, for example, So in bladder cancer, in cervical cancer, for women, in breast cancer. When we used the mammogram, just the mammogram, it used to identify things a year or more. Now, by artificial intelligence, we can 2 years or 3 years for lung cancer, for prostate cancer, for bone cancer, and the most difficult cancer, like the bone sarcoma, or ewing sarcoma, that was impossible to diagnose. Now, by artificial intelligence, we can identify the subtle things. So, in addition to the health informatics, in addition to the intelligent nodes, we have a lot of new era or a U-turn in the health service based on artificial intelligence. That's coming,
All right. Dr. Abdel Hady, dear viewers, allow us to watch another report and come back and continue our discussion here. And this report is about specifically the great success story of eliminating hepatitis C by 2030.
The hepatitis C elimination program has been completed, and the transitional phase reports on the program's impact and indicators until 2025 are being prepared according to the Ministry of Health. The Ministry of Health has announced the completion of the hepatitis C elimination program, marking a significant milestone in public health. The program, which aimed to eradicate the virus, has concluded its active phase. Currently, the Ministry is preparing transitional phase reports to access the program's impact and monitor key indicators through 2025. These reports will evaluate progress, identify ongoing challenges, and inform future strategies to maintain and build upon the gains achieved. The transition period is crucial for ensuring sustained success in hepatitis C control and furthering the goal of eliminating the virus completely. Egypt has become the first country in the world to obtain the golden class status due to the completion of the hepatitis C elimination process, an important milestone towards the goal of achieving the complete elimination of the disease before 2030. The spokesman for the Ministry of Health stated that the infection rate reached 9 cases per 10,000 new cases annually and similar levels of deaths resulting from the viral hepatitis. According to the Ministry of Health, Egypt is approaching the ultimate goal of eliminating hepatitis C with less than 5 infections per 100,000 new cases annually and similar levels of death from the viral hepatitis. It's worth mentioning that 118,208 patients with liver cirrhosis were included in the early detection and treatment of liver cancer initiative within 2 years of the initiative's launch in March 2022, which contributes to preventing them from developing liver cancer.
Welcome back, and thank you, Abi Hussein, for this report. I saw you nodding,
Yeah,
Dr. Abdel Hady, when you were watching the report closely. A great success story.
Very great success. Not only on the national level, but in the international level as well.
Indeed. I mean, what caught my attention here in the report, the sentence that talked about the fact that Egypt is the first country in the world to obtain the golden class status for the completion of the hepatitis C elimination process.
Yeah, that's the outcome of the very successful campaign or initiative of 1 million health. Indeed, it is a success story. You can read it everywhere in the most reputable journals that Egypt has made excellent progress in that field. And the story is called a story that you can tell. And the public health world has benefited from it. Now, what we are hearing here in the report is that we are moving towards 5 per 100,000. That is the best, or what's called country-free hepatitis C. If we can achieve that by 2025 or 2030, that would be great, you know.
We were talking about 0% here.
You will never get zero because the virus is still alive. But there is no zero.
The numbers are excellent here. We were talking about.
We are, we are among the top now. We have the gold mark that Egypt has made remarkable. We were 15 to 20% of the whole population.
Right.
Now we're speaking about 5 per 10,000.
Per 100,000.
The aim is 5 per 100,000.
Yeah, right. The aim.
The aim, is to go for.
Exactly.
Zero means there is no disease.
Exactly.
Which is,
not a single citizen.
Not a single citizen, there has been cases where the disease is eradicated from the world, like smallpox, for example. That was a dreadful situation. Polio, although polio is eradicated, but some cases are coming back. But let's speak about 5 per 100,000. That is a very noble optimism compared to 5 to 10% of the population.
Absolutely.
That's a huge difference. And the consequences as well, because if you eliminate virus C, you will eliminate liver cirrhosis, you will eliminate liver cell failure, and liver transplants. It's all going in a series that end with liver failure. So elimination of the virus is a cornerstone in the prevention of liver disease.
Dr. Abdel Hady, equitable distribution of healthcare services is a goal of the government. How do you describe the efforts in that regard? And I want to talk here about the presidential initiative Hayat Karima, or Decent Life, which had also very good hands in rural areas and in much of the poorest areas of Egypt.
Absolutely. Geographically, the distribution of health facilities in Egypt is marvelous. You cannot find it in the world. But functionally or de facto, what is the service provided was nearly none. So the aim over the last decade or so was to get these functioning. They are there. From your village, from my village, there is a
small clinic,
primary health care facilities is there. But what is the service provided there? There was nearly nothing, you know. But to get a physician there, to get medicine there, to get equipment for prevention of disease, to equip these facilities with digitalization, so you can record people, you get health records, that is going to cost money. And Hayat Karima, as you said, or Decent Life initiative, is based for the rural Egypt. That represents 60% of whole Egypt. So that's another very noble initiative that will help the poor, the deprived, in very poor rural areas to come up and live a decent life based on good health and good quality of life.
Right. What about specific initiatives that targeted women's health? I mean, I think there
My
are
domain,
many.
yeah.
Yeah, of course, it is your domain,
Yeah.
and I think there are many success stories in this area.
Absolutely. There is in the gynae side, on women's side, and also in the obstetric side on deliveries and babies and all this kind of thing. On the gynae side, the most successful initiative is the cancer prevention in women. Egypt has a very high record of breast cancer, and we started. And the good thing is Mansoura, where I come from, came first in providing service for women for early diagnosis and management. We have a very good cancer center, oncology center. So we just raise the hands of these good people. And now we added cervical cancer. Cervical cancer is a cancer mostly caused by the human papillomavirus. We used to early diagnose that and prevent it by happening by screening, cervical screening, which is now running in Egypt. The gap between the two is huge because breast cancer, we speak about 10 to 15% of women will be affected through their life spectrum, but the cervical cancer in Egypt is much less. It's coming to less than 1 to 2%. So there is huge difference between the two, but the good thing is you could prevent cervical cancer altogether and you could reduce the incidence of breast cancer. And of course, women like men equal in the other initiatives for, as I said, hepatitis and nutrition and all this kind of thing. But in the obstetric side or in the delivery side, the safety of women has increased during delivery, and an indicator for that is the maternal mortality or the death of women during pregnancy and childbirth. That has come drastically down from over 100% 20 years back. Now we speak about 28 per 100,000 or 30 per 100,000. So we are approaching high income countries regarding that domain. So women are usually, we say in this era, they are getting very good initiatives both on the cancer prevention, the quality of life, and also on the maternal mortality front.
Despite all of these successes, there are many challenges.
Definitely.
Many obstacles. Many things that I mean, experts and leading professionals like yourself want to see improve. What are the main challenges, obstacles, and what strategies do you need to see, to be satisfied, as a doctor, a physician? I'm now satisfied that now Egypt is just among the top in the world, and not just in the middle or in the upper middle. No, we want to be near the top. Or
Excellent. I would say a challenge. Health is a challenge for all governments. In the United States, in England, in Germany, in France. So we are not only facing these challenges. The challenges are huge because the cost for providing health service has doubled or increased 4 or 5 folds over the recent years because there was no organ transplant, there was no joint replacement, there was no valve replacement, there was no catheters. And the cost of this is huge. We now can put for just stent and the coronaries for the heart, 4 or 5 stents, each one now coming to 50,000. So the cost, the bill is huge. So
50,000 Egyptian
pounds, If the government has added 100 billion pounds this year, 2024, the budget, I would say if we carry on for that and adding extra 100 million pounds every year for 15 years.
Billion, you mean?
Billion, yes, billion. We were 400, we coming to 500 billion Egyptian pounds. We need to carry on doing that for the next 15 years in order to achieve that noble goal. In education, exactly the same, but the bill in education is heavier because it increases by 40 to 45%.
And naturally, we are a youth population, and
absolutely,
the birth rate is one of the highest in the world.
That's true. So the challenges are huge, but you have challenges in building hospitals and healthcare facilities, and equipping these hospitals with the new technologies. So you need to put a CT or an MRI scan so we can diagnose disease. You would put labs in and all this infrastructure. You need to get physicians. and the physicians should be paid enough, should be trained enough, should be dealt with as noble persons living good life experience, and also the governance of this organization should be up and running, like the equality of service. So all this will cost money and will need effort and sustainable investment in the human capital. And that's, I think, the new initiative, that the minister becomes the vice prime minister for a consortium of ministries that can work together to achieve that noble goal. We are on the right path, but we need to work harder, and work harder for so many years to see a reflection in the new generations.
And what about the Egyptian doctor or physician? I mean, it's being, for decades, we always say he or she is one of the best in the world.
Yeah.
Why is that? And do we still need more and more? Because we also have many who migrate.
Absolutely.
So my question is here, do we still need to see lots of high school students going to Faculty of Medicine in their university years, or do we need more in the nursing field? What is it that we need? And how can we benefit from those migrating super talented doctors and physicians?
Great, yeah. I totally agree with what you said. Egyptian physicians are among the best in the world. I used to work in the United Kingdom, I visited States. The Egyptian doctor is one of the top there. He's very respectable, the community admire that, and they ask for Egyptian doctors. Regarding enrollment of physicians in Egypt, we are not short of enrollment. But this year, there is a plan to increase the number of enrolled from 15,000 to 25,000. But, the big but.
So why? Why are we increasing the number if we're not short?
Because we cannot retain them. Yeah, so the number of graduates is more than enough for the population.
Good.
No, but we cannot retain them because of so many things that we know. Every person of us knows that the doctors in Egypt need more for training, need more for income, need more for security. And may I add that we need...
And this is why many of them choose to migrate.
Now we are facing a situation where there is magnet outside.
And they excel outside. I mean,
they are excellent physicians. They are among the best to perform in the healthcare facilities. Because our training is good, our medical education is good. But to retain the physicians, we need to address the points that need rectification.
You need another 100 billion again. So you need 200 billion per year, not just 100.
Absolutely. Yeah. But that's a hot issue because now they are discussing the law in the parliament. We need that law to come to be in favor of the physicians. I used to work in the UK. They say, no, we have zero tolerance for verbal or physical abuse for the physicians. Now, still the physicians are attacked. That's not acceptable. A lot of things for the training program for the physicians. And the last thing you said, those who immigrated or moved away, they are eager to come back. Many of them, I work with many of them, and we can, I may revisit, I used to say that, Indian experience. Most of the Indian physicians, they immigrate outside. They get training, they get higher qualification, and India, they get them back into the health service. And they increase hugely the health tourism in India. We can do the same now because we have a huge number of physicians. Yeah, you can't imagine, there are hospitals now where I used to exchange with my Egyptian fellow all the time.
Well, we need to make the atmosphere even better, and we need to spend more money
and more investment in health. But the physicians, they are good and they deserve to have good life.
Indeed. On that note, dear viewers, we've come to the end of tonight's edition of the Daily Debate. On behalf of you, we thank very much Dr. Saeed Abdel Hady, the former Dean of the Faculty of Medicine at Al-Mansoura University and the current president of a private university here in Egypt. Thank you very much. It's been an honor, sir.
Thank you, sir.
Thank you.
All the best. Bye-bye.
And thank you, dear viewers, for watching us. Please stay with Nile TV.